Hello all, I am Mrs. Binnie Matthew, nursing tutor working with Oyster Nurses Academy, Tiruvalla. We provide guidance for the Prometric classes to different Gulf countries, Dubai, Sharjah, Bahrain, Qatar, Oman and Saudi. Today we'll see about a new topic, muscular dystrophy. Muscular dystrophy is a rare condition, refers to a group of more than 30 inherited diseases that cause muscle weakness. These conditions are a type of myopathy. Over time, muscles shrink and become weaker, affecting the ability to walk and perform daily activities. The disease can also affect the heart and lung. Let's see the types of muscular dystrophy. There are more than 30 different types of muscular dystrophy. Some of the more common forms are, first one is Duchenne muscular dystrophy. In short, we call it as DMD. DMD is the most common form of muscular dystrophy. This condition tends to affect boys between the ages of 2 to 5. But girls can also get it too. They have a hard time running, walking or jumping. As the disease progresses, it can affect the child's heart and lung. The second one is Becker muscular dystrophy. In short, we call it as BMD. BMD is the second most common muscular dystrophy. Symptoms of BMD can appear anytime between age 5 and 60, but typically come on during the teen years. Males are most likely to get BMD. The disease affects the hip, thigh and shoulder muscles and eventually the heart. The third one is facioscapulohumeral muscular dystrophy. In short, we call it as FSHD. It is the third most common muscular dystrophy. The disease affects the muscles of the face, shoulder blades and upper arms. Symptoms tend to appear before age 20. Next is congenital muscular dystrophies. Short we call it as CMD. CMD are present at birth. An infant may have weak muscles, a curved spine and joints that are too stiff or loose. Children with CMD may have a learning disabilities, seizures and vision problems. Next one is Emery-Dreifuss muscular dystrophy. In short, we call it as EDMD. This condition tends to affect the children. Symptoms such as weak shoulders, upper arms and calf muscles appear by age 10. EDMD also affects the heart. Next one is limb girdle muscular dystrophy. Short we call it as LGMD. This disease affects the muscles closest to the body, including the shoulders and hip. It affects people of all ages. Next one is myotonic dystrophy. People with myotonia have trouble relaxing their muscles. The disease also affects the heart and lungs. The last one is oculopharyngeal muscular dystrophy. Short we call it as OPMD. This rare form of muscular dystrophy weakens muscles in the eyelid and throat. Symptoms such as droopy eyelids and difficulty swallowing often appear between the age 40 and 60. Moving on to the causes. Genetic mutations or changes cause most form of muscular dystrophy. One or both parents may pass a faulty gene to their child even if the parent does not have the condition. Next is the symptoms of muscular dystrophy. Muscle weakness is the primary symptom of muscular dystrophy. Enlarged calf muscles, difficulty walking or running, unusual gait, trouble swallowing, heart problems such as arrhythmias and heart failure, learning disabilities, stiff or loose joint, muscle pain, curved spine, breathing problems. Moving on to the diagnosis of muscular dystrophy. The people with muscular dystrophy will be having an elevated levels of creatine kinase. We have to do the EMG, electromyography. A muscle biopsy looks for a cell changes in the muscle tissue. Genetic test identify gene mutations linked to muscular dystrophy. Next is the treatment for muscular dystrophy. There is no cure for this disease. Disease symptoms get worse over time, but the following treatments can help. Physical therapy and occupational therapy will strengthen and stretch the muscles. Speech therapy helps those who have problems with swallowing. Corticosteroids may slow down the disease progression. Surgery relieves tension on contracted muscles and corrects spine curvature. Heart assist devices such as pacemaker to treat heart rhythm problems and heart failure. Medical devices such as walkers and wheelchairs can improve mobility and prevent falls. Respiratory care such as cough assist devices and respirators helps in breathing. Thank you. See you all soon with a new video.